Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my boards exam, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about how to treat trochanteric bursitis or hip bursitis. It probably helped to actually know what bursitis is, so if you need an overview, check out my What is Bursitis video. Otherwise, if you don't need it, let's get straight to it. With bursitis, the bursa is the source of pain. The bursa itself is not a structure that I can consciously tell to contract or do something with. It's not something like a muscle. So understand there is nothing that I can do directly to the bursa itself. But the idea with exercise and rehab and treatment for those who have bursitis is to treat the surrounding area. The surrounding area meaning the surrounding muscles. I want to strengthen my muscles so that they can help with shock absorption. It can help with reducing the amount of forces that the bursa would otherwise just take alone. So I want some of that shock and force to be distributed between both my bursa as well as my muscles. I also want to make sure that I'm stretching certain tight muscles that are creating compressive forces on that already irritated bursa. I also want to make sure that the way I'm moving isn't creating too much friction or irritation to the bursa, so I'm working on movement patterns as well. Additionally, if the surrounding muscles of that bursa are not strong enough, it doesn't provide any stability. I cannot balance on one leg if I don't have the strength to hold myself up in the first place. Well, if my hip muscles are not strong and they essentially shake when I'm moving, shaking is shifting, right? They're shifting structures back and forth just really quickly. So if I'm shifting back and forth, this is friction. And too much friction at the bursa is what can lead to things like bursitis. In this video, I'm going to give you 3 exercises: a stretching, a strengthening, and a coordination. In this day and age, humans sit a lot, and as a result, our muscles get very tight, specifically the front hip muscles. So if you look at the muscles that cross over that trochanteric bursa, or the hip bursa, the muscle that is right in front of it is the TFL, the tensor fascia lata. This is another view of that muscle. So here you can see that muscle turns into the IT band, but that's for another video. If this TFL muscle is tight due to us humans just constantly sitting, can you see how the tightness of this muscle is going to pull and squish the bursa? Well, the bursa is already irritated when you have bursitis, and now you have a structure that's constantly pushing and rubbing up against it. So let's get that TFL muscle to loosen up a little bit by stretching to give it some slack. That way it can reduce in how much tension is applied at the bursa. That way you allow that bursa to actually heal. So here's how you do that stretch. You're going to stand up with the side that is affected away from the wall. So take about 1 or 2 steps away from that wall. You're going to cross that leg behind you and lean your arms or your shoulder against that wall. You want to jut your hip away from the wall, and when you do that, you should feel a stretch at the front side of your hip, and that is your TFL muscle. So hold this for about up to a minute. Break it down, 4 sets of 15 seconds, 2 sets of 30 seconds. Try this once a day, twice a day, depending on what you feel you need. Take a look at this image to see a different muscle that crosses over the bursa. So what we're looking at right now is the back side of someone's right leg. So we're looking at the hip region. What's boxed is the gluteus medius muscle, and then you can see its relation to the trochanteric bursa. Here's another view so that you can see what we're looking at. This is the gluteus medius muscle. When this muscle is weak, when we're walking, we tend to see Trendelenburg. Trendelenburg is what you think about when you look at the hips of a fashion model walking. You'll see that when they walk, their hips drop side to side. If you're a model, I'm not sure if it's really because of weakness that it's happening. I'm sure it's probably intentional, but if you're not a model and you're not thinking about intentionally dropping your hips as you walk, it's likely due to one of 2 things: muscle weakness at the glute medius, or you're not intentionally trying to contract the muscle as you walk. Now, if your hips are dropping every single time that you walk, or at least pretty much every single time that you're moving, can you see that a ton of movement in this area is going to create a ton of friction at the bursa? So if we can strengthen this gluteus medius muscle to where it's strong enough to avoid that Trendelenburg or that hip dropping, we're going to reduce the amount of friction that that bursa is going to experience. That way we can allow that bursa to stop being irritated and allow it to heal. This is how you strengthen that muscle. This is an incredibly common exercise to give people. However, most people do it wrong, so please pay attention to see how you actually target the muscle that we are addressing. What you want to do is lie on your side with the affected or involved side on the top. So if it's your right hip that's bothering you, you want to lie on your left side. The left leg, the bottom leg, bend it. You want to feel stable as you are doing this exercise. Roll your entire body forward about 20 to 25 degrees. The reason being is that this allows for the gluteus medius muscle to be directly facing the ceiling. And we want this because we want to utilize gravity to its optimal potential. Keeping your top leg straight, you're going to raise that leg at a diagonal angle up and behind you. As you do this, do not roll your body backwards. We want to keep that forward rotation of about 20 to 25 degrees. That way we can really isolate that gluteus medius muscle. The muscle you should feel should be at the top back corner of your glute region, top corner butt muscle. If you feel it in the front of your hip, you're doing it wrong. If you feel it in your quads, the front of the thigh, you're doing it wrong. If you feel it on your inner thigh, your adductor muscles, you are doing it wrong. It has to be felt at the top corner glute muscle in the back. This is a strengthening exercise. So when you do it, you should feel your muscles burning. They're being used. It shouldn't be that you're using momentum and just flinging your leg up and down, okay? We want a controlled contraction. So think about as you're bringing your leg up and down for that repetition to take about 3 to 5 seconds. What you want to do is perform this exercise 3 sets of 8 repetitions. And these 8 repetitions should be hard. If you feel like you can do 15 in a row and you're actually doing them correctly, you're doing them for 5-second holds, and you solely feel it in that gluteus medius muscle, that's when you might want to invest in an ankle weight to increase the resistance. Otherwise, you can always change an exercise to be a bit harder. For this exercise, it's strengthening. You don't want to do a strengthening exercise every single day because that can result in injuries. You're overdoing it, you're straining it. So what you want to do is these challenging 3 sets of 8, about 3 days a week, every other day. If you have a day where you feel extra sore and you need a 2-day break, it's okay. You're just starting off with these exercises. The last one is a coordination exercise. Understand that there is no point of strengthening a muscle and getting stronger if you aren't going to use that muscle during your everyday functions. If your hip is hurting due to bursitis, are you going to stop walking? Are you going to stop going up and down your stairs? Are you going to stop standing up from a chair or sitting down in a chair? The answer is probably not. So what you want to do is work on actually utilizing the muscles that we're working on. So every time that your foot is on the floor when you walk, you need to intentionally and purposely contract your gluteus medius muscle, the one that we just worked on in that strengthening exercise. Every time that you stand up from a chair, you need to try pushing a little bit more with your heels to help you squeeze the gluteus medius muscle. If you're going up the stairs, the foot that is driving your leg up onto that next step needs to have the gluteus medius muscle contracted. So the leg that's in the air, though, that does not need to have the gluteus medius muscle contracted because it's just swinging. Only the foot that is currently on the floor do you need to have that muscle contract. So as soon as that foot hits the floor, you need to squeeze that muscle. Remember, the function of that gluteus medius muscle is to keep your hips level and stable. If it's not stable, it results in a bunch of friction and movement in the hip, which leads to friction at the level of the bursa. And that's exactly what we're trying to avoid. So changing your movement pattern and using muscles that we already have to offload how much irritation the bursa gets is what the concept is all about. Realistically, this is the way that we should be walking regardless of the evidence of injury. However, it's not until usually an injury happens to where we really need to start thinking about how we move, because when we have pain, we start to change the way that we move to avoid the pain. But we have to relearn and really emphasize certain movements that help us improve our mobility. Hopefully this clears up some questions you might have had about how to treat trochanteric or hip bursitis, whether you're a student or a person who's going through it. If you're studying for the NPTE and you enjoy the way that this was taught, check out our courses at sptwithme.com. If you've been diagnosed with any disease or condition or injury, etc., the best thing that you can do is actually go to see a physical therapist. That way they can see you, they can test you, they can evaluate you to see what the most appropriate exercises would be for you. I don't want you to risk injury. I don't want you to risk falling. I want you to feel safe. Now, you probably clicked this video because either you don't want to go see a therapist or you don't have the means to go see a therapist. I understand. But understand, with these videos, I have not seen you. I don't know how you're presenting. I don't know what your limitations are. So with that being said, if you choose to use these exercises and implement them, please use your best judgment to see whether or not it's appropriate for you. Now you might be thinking, well, you're right. I haven't seen you. So how would she know what to give me? Well, understand that humans tend to fall into similar movement patterns when certain injuries are present or certain diseases or conditions. So that's how I chose these exercises. It's really based on trends that we see with specific situations. Check out these references for more information.